Piriformis syndrome is a neuromuscular disorder where you have numbness and tingling from the buttock going down to the knee. There's a little muscle in the hip called the piriformis, and this muscle, when it is tight, can squeeze or irritate that sciatic nerve. We've all had nerve pain before. A lot of us, almost all of us, have experienced nerve pain in our funny bone. Whenever we hit our elbow and we get pain going from the elbow into the fingers with a numbness and tingling type feeling. That same feeling is created anytime that you make contact with a nerve. And the same is true at the piriformis. When that piriformis squeezes or contacts and irritates that sciatic nerve, it can give you that numbness and tingling going from the buttock down to the knee. Now we need to differentiate between two disorders. One is a disc issue, meaning that the disc is either bulged or herniated at the spine level, contacting the sciatic nerve at L5-S1. If you have pain going from the back down to the toes, then you most likely do not have piriformis syndrome. But if you have pain starting in the butt or the hip, going down to the knee and sometimes the calf, then you most likely need to be checked for piriformis syndrome. There are several things that we recommend for piriformis syndrome. First is supplementation. We recommend that you go to one of the local drugstores and purchase calcium, B12, vitamin C, and potassium. We also recommend stretching and exercises to combat your piriformis syndrome. One reason that I love this stretch is that it can be performed anywhere that there's a chair. So here's how you begin. First, you'll scoot up to the very edge of the chair. Then you'll cross your leg, cross the leg that you're having the pain going from the buttock into the knee with. Then you'll sit up straight and then bend forward, making sure that you do not bend or flex at the low back, but that you're flexing at the hip. Imagine that it's a door shutting and that is your hinge. The hip needs to be where you're getting most of your motion, if not all of the motion. You'll find where you meet the barrier or where you feel the stretch the most. Back off of it just a little bit and then hold it for 8 seconds. Once you've held it for 8 seconds, take a deep breath in, and then on exhalation, lean forward at the hip till you find the next barrier. And repeat the process. Back off, hold for 8 seconds, deep breath in, exhalation, and then move forward. If you or someone you know is struggling with some of these symptoms that we've talked about, that numbness and tingling from the buttock going down to the knees, and you think that it might be piriformis syndrome, feel free to call us at 337-565-4200 and check us out on our website at myreliefplus.com. We are the clinic for life's aches and pains. Feel free to give us a call anytime. We would love to help.